Hello everyone, my name is Asante Minor and I am a senior at Winston-Salem State University. I am set to graduate next semester. I graduated with my associate's degree in 2023 from Beaufort County Community College. I have been a tech for over 2 years now and I work full time. Today, I'm going to be talking about the impact of broad spectrum antibiotic therapy on Clostridioides difficile infection. It is also known as CDI or C. diff. So here's an introduction. So around 500,000 people in the United States suffer from CDI annually. The condition is strongly associated with the use of broad-spectrum antibiotics. Changes to the bacteria increase susceptibility. It leads to severe diarrhea, colitis, and prolonged hospital stays. All right, now I'm going to be talking about broad-spectrum antibiotics. They are effective against a variety of pathogens, commonly administered in healthcare settings. High-risk antibiotics include, now excuse me if I am pronouncing any of these incorrectly. All right, so we have fluoroquinolones, cephalosporins, and clindamycin. Repeated or extended use rises the likelihood of developing CDI. Disruption of the gut microbiome. It reduces bacterial diversity, loss of colonization resistance, allows C. difficile spores to grow and produce toxins, increases infection severity and recovery time. All right, so now we're going to move on to antibiotic resistance and persistence. All right, so this promotes resistant strains such as ribotype 027, increased toxin production, longer environmental persistence of spores, harder to treat and control. All right, so the environmental transmission. Spores survive for months in hospital environments, resistant to routine cleaners and alcohol-based sanitizers. Patients on broad-spectrum antibiotics shed more spores, requires strict infection control and stewardship. Counter argument. Broad-spectrum antibiotics can be necessary initially, used for severe or unknown infections, critical for patient stabilization. Revitual. Overuse significantly rises CDI risk. De-escalation to narrow spectrum agents is essential. Stewardship programs reduce CDI without harming care. All right, here is my conclusion. Broad spectrum antibiotics disrupt microbiome and increase CDI. Promote resistant strands and environmental contamination. Expected outcome. Improve understanding of stewardship importance. Targeted prescribing protects patient safety. So I have a mixed view of broad spectrum antibiotics. I understand that they can be life saving in serious or uncertain infections, and they play a very important role in patient care. However, I also recognize that overusing them can disrupt the gut microbiome, increase the risk of C. difficile infection, and contribute to antibiotic resistance. Because of this, I believe broad spectrum antibiotics should be used very carefully, only when necessary, and then switch to a more targeted option when possible. They are very valuable tools, but they need to be used responsibly because it can cause more harm than good. By prioritizing targeted therapy, hospitals can reduce infection rates and preserve the effectiveness of antibiotics for future patients. This research highlights how small improvements in prescribing practices can lead to major gains in patient safety and public health. I really hope that you guys enjoy my presentation today. Thank you all for listening to my presentation. If you have any questions, comments, concerns, you can comment under my link, and I am more than willing to answer any questions that you guys may have. Thank you again.